Diana Rochester. I am an instructor at the Ashton College for this particular program for mental health and addiction support worker certificate. And we're going to talk a little bit, of course, about a little bit program, but mostly I'm going to do a little micro session about the topic that I'm very passionate about and interested, especially after finishing my master's and learning more about the application of different like interventions and different theses that I've been learning about. And let me just quickly share the screen to kind of begin. I'm really passionate about it because I did work in a lot of group homes throughout my bachelor's degree and while I was transitioning from bachelor's to master's, and of course a little bit in the beginning. Um, Throughout working in the group homes, there was some issues and problems that I've encountered, and the way system can be improved in many ways. And that's kind of what I'm going to be working on after, of course, finishing my master's and getting more into the field of clinical counseling is enhancing care in group homes and enhancing how we can be more productively working with the people, youth and young adults, and also kids. I'm very passionate about working with kids. That's what I've been doing for majority of my career in life. And let me just, okay. So before we begin, we're going to do a brief overview of group homes, what their purpose is, their common challenges for the residents, and what you usually would encounter working out in the field as also mental health worker and addictions support worker. It's very important. So of course, the purpose of the group homes is safe, stable living environment. Unfortunately, a lot of young adults and the youth, if they come from like bad household situation or they get kicked out or their parents pass away and they can't access any type of housing or shelters, group homes are definitely a great way to assist them, especially if they have mental health challenges. So safe, stable living environment is one of the main purposes for it, to help people transition into the adult life, to have some stable kind of house and kitchen and food security to ensure that they have the basic needs before they transition into the next steps, like the Maslow hierarchy of needs. You need to have safety and stability and like food and the shelter before you can start working towards other skills that will help you throughout your life. Then the second purpose is supportive therapeutic setting. A lot of youth, adults, teenagers, and kids go into the group homes because they need because of their mental health struggles. For example, if they're on the spectrum and have severe ADHD or FASD, which is fetal alcohol syndrome disorder, it's very important they kind of work through it all and they get support from people that assist them to work through all those skills, through their struggles, and how to enhance kind of their life skills and enhance their living situation and overall kind of be a more functioning adult and a youth. Then skill building, kind of same as the second point, but it's more about the emotional regulation skills, being in the present moment, living by the values. It's very important, and group homes do help with those skill building. It also includes group a lot of groups were like support groups or skill groups, or it's a lot of groups that I've seen was like even teaching basic life skills like how to brush your teeth, how to do your laundry, how to cook. Also, there's a skill groups for like wellness and mental health and depression, for emotional regulation, basic skills, even such as like how to go and find the assistance from the government or how to go find a social worker or any healthcare worker. Then, of course, trauma-informed care. If it's mostly applicable to young adults, teenagers, and kids, a lot of them, unfortunately, who can have behavior problems or developmental delays. Families not always can handle it. Not all families have the resources to help with it. And unfortunately, kids do need to be placed in the group homes or care facilities where through the specialists and support workers, like potentially future yourself, you help those kids to kind of adjust their behaviors in a better way to kind of learn the emotional regulation skills. So instead of throwing something into the wall or kicking someone, they learn how to do breathing exercises or how to journal about those things or exercise or any other ways to cope with those things and cope with their emotions, cope with their thoughts. and plus also help the parents to learn those skills to help them. So when the kid transitions from the group homes back to home, parents know how to handle it. Parents have the knowledge, understanding, compassion, and skills to help the kids and their youth. And trauma-informed care is also important because a lot of families can experience some sort of trauma, vicarious trauma, or someone has passed away, and that could trigger the negative behaviors. Or, for example, family went through food insecurity, housing insecurity, that can inflict a lot of trauma on the kid, where a lot of problems, behavior problems most of the time do occur. Or if it's a single mother with a kid who experienced domestic violence from the partner, again, help the mother, help the kid. And it's very important to have trauma-informed care that kind of helps with with the compassion, with understanding, and understanding that's like a holistic process to assist everyone. And of course, community connection, helping people connect with the resources like food shelters, food banks and the shelters, or where to get the clothes, or where to get the social worker or legal help or clinical counselors or mental health support, and just kind of connect it all together. And most of the time, it's also all those points together, and it's important to understand it's like that's the purpose of group homes. It's not the purpose of like just sending out people and leaving them at the B. It's not point of that. The point of group homes is to support and help people to be living adults and transition into better life and support them through it. Common challenges for the residents, and all of them kind of apply no matter what age the person is and what stage of life they are. So of course, emotional regulation and trauma response, especially kids who lost their parents or adults who went through a lot of turbulence or were kicked out of the house. Emotional regulation and trauma responses are very common, and it's important to understand that's where it comes to trauma-informed care, that you need to understand people went through a lot of trauma and a lot of their negative behavior responses come from it. And it's a lot of challenge, and it's important to have the education and compassion to handle it very well. Trust and attachment. How can someone trust you if they were always being betrayed by the adults that were supposed to help them? And attachment issues, insecure attachment is a big one. And unfortunately, even when a person is in a group homes from childhood, they've seen a rotation of adults. They've never had a safe adult, so their attachment style is very insecure, and they don't know how to even build those connections with people. Then identity and self-worth. Low self-esteem is extremely big problem, and it doesn't matter if it's a female or a male. Identity and self-worth is a big problem, is a big struggle, unfortunately, and building the identity and helping people finding it and finding those values and finding their kind of purpose in life is a big problem because they don't even know who they are. And when they don't know who they are, they can have emotional regulation skills problems because they don't even know what can even help them. Behavior challenges, as we kind of talked about already, the system burnout, it can apply kind of both ways to people in the group homes and to the staff that works there. And it's important to understand that it comes from the lack of the resources that often happens in the group homes because most of them are government funded and there is not always enough funding to help every single person that we can possibly help. And also for the system burnout is for kids who go from their childhood into adulthood throughout different group homes and care facilities, they get burned out because they never had a stable home. They never had a stable adult. They never had a stable help. Every day is unpredictable. They never know what can happen tomorrow. And unfortunately, with a lot of youth and teenagers that I've seen, is that if they act out behaviorally and if there is no proper support systems and the system is kind of already failing them, oftentimes they can be taken from one group home to another in a blink of an eye without any like kind of warning or any kind of preloading about what can happen, and that can be create a burnout. It can have create obviously identity crisis, behavior challenges. It's all very interconnected with it. Life transitions uncertainty. Also, as I mentioned, like if you don't even know where you're gonna sleep tomorrow, How do you know if you're ever gonna turn into adult who can have their own place, get a job, or get any type of training or education? And pretty much poor people can't even plan their day for tomorrow because they don't even know if they have somewhere to sleep tomorrow, or if they will be taken out, or they're gonna get kicked out. Will they have food? Will they not have food? And that obviously takes a lot of mental toll on people. And of course, another one is overwhelming environments. It's a group home, and we know in a lot of places and a lot of kind of systems and group homes, you can have way too many people in one housing, and sometimes kids or adults need to share their room with like up to 4 or 5 different people. There is no personal space, there is no sometimes security, and especially if it's behavioral issues and you have a lot of people with behavioral challenges, behavioral problems, there's a lot of aggression, there can be fighting. Um, Also, if in the sense of security, a lot of people can smuggle something inside of a house, and it can be either a weapon or drugs, and it can be overwhelming. Nobody can feel safe enough sometimes. And even sleeping can be challenging because you don't know, will your kind of neighbor next door or in your room just gonna come and disturb your sleep in any shape or form. And it can be extremely overwhelming. And again, of course, if you have the constant rotation of the staff, you don't have an adult, you don't even know who's gonna come in tomorrow to work with you and to help you and to just make sure you have food on your plate. So it all takes an extreme emotional toll on everyone. So, why psychological flexibility, which is the biggest part of ACT, matters in residential care? So, of course, psychological flexibility is the ability to stay present with difficult thoughts and feelings, choose actions based on personal values rather than reacting automatically, and from fear, habit, or discomfort. So, psychological flexibility entails you being able to diffuse from emotions and your sensations and feelings. It's being able to ground yourself, to get into a present moment, to be able to control of yourself and get your autonomy, to take an appropriate action instead of living by fight or flight or freeze habits. You actually get yourself into a present moment, your psychological flexibility to make a correct decision that would actually benefit you in the long term rather than doing something that will help you right in the moment short term. And why obviously psychological flexibility is important in the group home settings. So residents often feel controlled by the system, of course, because again, they don't even know where they're gonna live. They can't control even sometimes what food they can eat or what clothes to wear. So building flexibility restores a sense of agency and empowerment, gives you this sense of autonomy that you are in control of some things, maybe not everything, but you can still control some of the outcomes and what can happen to you in the future. Behaviors are often survival responses. So, flexibility helps residents understand emotions without shame and choose new responses. So, a lot of times, because of the stigma, a lot of people feel like they're being shamed for their feelings from their past and the way they sometimes behave because of the past and because of the way they feel. So, psychological flexibility helps you to connect with your feelings, with your body without being shamed, without being discriminated. And it helps not only to process what you feel, not to only to process what happened to you in the past, but helps you to choose new responses. And even if that response doesn't work out and maybe still has some negative impact, it still helps you to learn that, oh, this didn't work out, so I can do something new and different in the future, and that can greatly help and impact the potential future in a positive way. So, of course, supports emotional safety. Residents learn to tolerate distress without escalating or shutting down. So, as mentioned, people learn to connect with their body, with their mind, with what they feel and their emotions. And they will learn that expressing their feelings, expressing their emotions is okay, that there is still safe space because you as a support worker, you're almost like a caregiver. You're almost like a sibling, a friendly kind of professional. And giving them that space will help them to learn those principles and skills way faster. It helps them to understand that, oh, it's okay to try and fail and try and succeed or try and fail again. And it helps to do that without escalating, without shutting down and never try it ever again. Because a lot of times people will try to be vulnerable, will try to give a chance to be who they are vulnerably. But unfortunately, when you do not respond correctly and don't give that safe space, they will shut down, they will escalate, and they will never try again. It also promotes healthy relationships. So, flexibility makes space for trust, honesty, and connections even when conflict arises. Because a lot of times, of course, if there is lack of trust because of their trauma, because of their past and their family kind of situation, it's important they learn that you can trust. And if person kind of fails your trust or fails to support their trust or reciprocate it, it's okay, it's on them. You can still be this open, vulnerable person until you find someone who will reciprocate and be the same person with you as well. And if conflicts arise, it's okay. It's part of being a human. It's okay to have that. It's part of having relationship, no matter if you're friends, family, just co-workers, or you're just kind of in one similar space. And people in group homes do struggle with it. They think that even smallest disagreement is the end of the world. That's it. They can never recover from it. And that's when you have also, again, escalations, behavioral problems, shutting down, running away from a house and never coming back. So it's very important to promote those healthy relationships. And also, you as a support worker are the one to not only help with it, but also to facilitate and keep showing up for them to show that this is the healthy relationship and be a kind of a role model for it. So values create direction. Many residents feel stuck. Values exploration gives a sense of purpose and hope. Because oftentimes, even though you might not know if you're gonna live in the same place tomorrow or no, you can help people find the purpose in life. Purpose in life helps to reduce level of anxiety, depression, suicidal ideations, suicidal behaviors, um, even like behavior like outbursts. Having values is important because values is an anchor that brings us back to who we are, brings us back to where we are and where we want to be, and guides us which direction to go. And it helps to go back to values and kind of, are we going with this behavior away or towards our goal and biggest purpose in life? It also builds resilience. So the goal is not removing all challenges, but facing challenges skillfully. Nobody can live a life without any turmoil or without any challenges or any stressors. That's pretty much impossible, no matter how well-rounded person you are, how successful you are still gonna encounter some of those things. So building resilience is important, of course, especially people who went through the trauma or uncertainty or betrayal or any of those things. And it's important to help to guide them to build that resilience through different skills, through talking, through again going back to values, building relationship, and all of those things are extremely interconnected with each other. So impact on community and environment. When residents and staff use ACT principles, it of course helps to conflict to de-escalate faster, communication becomes more respectful, residents support each other through shared values, routines feel collaborative rather than authoritarian, and staff burnout decreases because interactions are more meaningful. So of course, if you have the skills for emotional regulation, for coming back to your values, to choose the correct path and being proactive about it, there's less conflicts as well. And if they are, they de-escalate better and faster and more proactively, that in the future those conflicts can be avoided. Communication becomes more respectful because of course they will kind of stop taking things personally. People will stop feeling like they're being attacked personally, that they are the problem. And of course, again, with Emotional regulation skills, understanding their values, understanding what's kind of wrong and right for them, helps to communicate not only with other people better, but with themselves. A lot of residents, unfortunately, in group homes and care facilities, use very disrespectful language towards themselves. They keep saying, I'm a failure, I'm the problem, I'm stupid, I'm dumb. And of course, it sends a message to their brain that that's who they are. And that's when the brain chemistry changes, and that's how brain makes you actually feel that way. But if you use respectful language towards yourself, that, oh, I just made a mistake, it doesn't mean I'm dumb, your brain doesn't take it personally. Your brain chemistry is actually changing more better because neuroplasticity is an amazing thing. And your brain sends a more like calm, relaxing messages to your body that's nothing to be very tense or stressful about. And of course, if all residents use respectful language, better communication skills, emotional regulation skills, residents are way better at kind of communicating with each other, living with each other. And that's when groups are also extremely helpful, having like a group therapeutic moment where people share their experience, their struggles, and they can support each other through communicating with each other better, be there for each other, building connections, and again, learning trust and communication skills with each other. Routines feel collaborative rather than authoritarian, is more especially for youth and teenagers and kids, especially as adults. And as a support worker, you understand the importance of eating well, having a good hygiene, keeping your place neat, being friends with each other rather than fighting each other all the time. Kids don't really understand those things and they will rebel. And that's normal. It would be weird if nobody would rebel or question you or your authority or why you're asking them to do this. That would be really weird. That's what teenagers and kids do. It's normal for them. But through kind of collaboration, good communication skills, and showing that you're there to help them and they can trust you and your judgment, they will be more collaborative. They might not rebel as much. They might just ask more questions as to why, rather than just straight up shut down and say no and fight about it. And self-burnout decrease is important because as a support worker, you put your heart and soul into all those residents. But if you see your residents being unsuccessful, if you see your residents being like not having emotional regulation skills, having outbursts, harming themselves, it will burn you out. But if you see that your residents, of course, are flourishing, learning skills, and improving, you can even have more meaningful interactions with people. You can feel like what you're doing is actually helpful and is actually there to help and make a change and create new purpose, not just for yourself, but for also other people. So what is ACT in itself, other than just like what would be the benefits of applying it? So ACT is a modern research-supported behavior therapy, but it's also used, the principles of ACT are not just used in the behavior therapy, it's also used for cognitive behavioral therapy and dialectical behavior therapy. Its all principles are used in many other therapies, and now it's been put in one big thing that can be used no matter what age you are and stage of life. So developed from relational frame theory and contextual behavior science, and focuses on acceptance, mindfulness, and value-driven actions. And it's not just about changing thoughts, but changing your relationship with the thoughts. And to kind of go further from it, and also to change your thoughts, to change your emotional state, how you see yourself, how you see others, and being able to take a step back kind of and see the situation from almost a third person to have a bigger, fuller picture and being able to respond to situations way better. So how does ACT works? Let me just move a couple things here. So it starts with the acceptance, allowing space for thoughts, feelings instead of fighting them. And acceptance also helps you to just give the space for who you are, what you're experiencing, and being okay with it. That it's okay, I'm feeling this way, it's okay, I'm experiencing it. I want to give it space instead of fighting it. So by giving space, I know what next steps I can do depending on what is even going on inside of it. Because a lot of residential residents in the group homes and care facilities don't always even know how to name their feelings. They don't even know what the difference between anger, sadness, frustration, disgust, and fear. It all feels exactly the same for them. So acceptance teaches you how to accept that feeling and actually name it, know the difference, so that then you can create a plan how to work it out. Then we have diffusion. So it's seeing thoughts as mental events, not facts that control you. And the best representation of diffusion is that you accept that you have a feeling and a thought, but I'm separating myself from it. I'm building this wall in a good way. I'm putting this separation because I can have this feeling and a thought, but I'm still a human. I still have my two hands, my 2 feet, and my head on the shoulders, and I can still be a productive human being. I can still do something about it instead of just feel almost like paralyzed by it. Then the present moment focus, which is awareness of what you're experiencing right now. So you accepted your feelings, you took a step back from it, and now you're in the present moment to understand this is the feeling, this is the thought. I understand that this is happening with me because of what's currently happening right now. And now what can potentially can be done next after I also ground myself, after I take a breather, do my five senses, do my breathing exercises, what's next step that I can do? And then you do self as a context. You are more than your pain, your past, and your labels. And you go into this third person mode to also see a bigger picture after present moment, coming back to reality and grounding yourself. You can take kind of a look on the space around you. Well, maybe there is something in the environment that's happening. Maybe I'm just simply hungry. That's a big one. People don't recognize at the group homes oftentimes that they're hungry, and that's where a lot of problems do arise from. Maybe I'm hungry. Maybe this another person who maybe insulted me is having a bad day, so that's why they acted that way, and I should not react back to it, and so on and so forth. But you're taking this third person perspective from the situation. Then we go to values, clarifying what matters deeply to individual, to yourself. So let's say someone called you names, it triggered you. Now you're doing all the steps, and you go to your values as an anchor, as I mentioned before. Okay, this is my value. I want to be a good, respectful person. So I'm going to go towards my value and a bigger purpose. And I'm just going to move away, give that person space and do my own thing. But what if I choose to go away from a value? I'm going to go fight back that person. And that's going to just cause another big problem. And then committed action. You chose your value, you chose the value you want to live by, and you're actively taking your steps to live by it by leaving the room, giving person space, talking through this person, doing breathing exercises, coming back to the middle ground, grounding yourself, being in the present moment, just doing what you believe is the best for you. And this is kind of the model of how the act looks like. It's kind of this beautiful hexagon and it goes into a circle, but the beauty of act is that, as you can see, there's different lines in the middle, and you can jump from diffusion to committed action, from self as context to the values, acceptance to present moment. It doesn't have to be in the order that I listed. It's just the most common order that works the best and kind of foolproof, but you can play around with it. And it also has this beautiful kind of text that shows what happens if you don't follow it. So let's say you don't want to live by your values, then you have lack of contact with your values and you just don't know how to act. You don't know where to go. You don't know what kind of committed action to use. You don't know what present moment awareness to use. You don't know what diffusion method to use. And then let's say you are not using acceptance in the moment, so you using experiential avoidance. And when you use experiential avoidance, what you will see is people just shutting down and just going numb. And when that happens and occurs, unfortunately, people, by shoving down their negative feelings and emotions, they also shove down their happiness and joy and all the positive, beautiful emotions we also experience. People have, like in emotion theory, people have five basic emotions. Four of them are negative, and then we have joy. The other one was like, I believe, fear, pain, sadness, and anger. Those were one. So when you have those primary emotions, when you shove down one, you don't experience anything else, especially if you do it long term. So by shoving down your anger, your sadness, your frustration, you shut down your happiness. So using acceptance, you're allowing yourself feel bad emotions, of course, but you also allow yourself to finally experience happy moments to the fullest. And of course, if you don't do present moment awareness, you can't even recognize your emotion, your feeling, your experience. You don't recognize what is happening around you. And even if you're like in a good moment, like watching a great movie, enjoying a good meal, or like taking a nice bath, if you're not in a present moment, it just feels like a chore. It just feels like you were forced to do it, and there's nothing good that comes out of it. There's nothing positive that comes out of it, and person just again shuts down and nothing good to experience or feel. So why ACT is effective for youth and adults? So of course it's approachable and active. It's used as metaphors, activities, and mindfulness, not heavy talk therapy. And it's non-pathologizing. It helps residents feel seen as a whole people, not diagnosis, because ACT can be used on people who are just experiencing momentary distress. You don't have to have depression, anxiety, bipolar, borderline personality disorder to use ACT. You can be a healthy, high-functioning person, but you're having just kind of rough patch in life. You can still use ACT. There's nothing bad about it. You don't need to have diagnosis to use it. Like, for example, for DBT, you need to have bipolar disorder kind of, or bipolar in general to be able to use DBT effectively. For CBT, you need to have like anxiety or depression to be able to use CBT effectively. ACT can be used no matter who you are, and it does not discriminate any people pretty much. It's future focused, it builds hope and purpose beyond the system. So as I mentioned, people having values and finding their purpose in life, even if they don't know, are they going to stay in a group home tomorrow or are they going to move anywhere tomorrow, they still have future focused view. They still know what their goal is and what steps to take for that goal in the future, even if present is uncertain. And it fits daily life. Tools can be used in the moments like conflict, stress, chores, school, or group sessions. So as I mentioned, if something happened, you accept it and you can do grounding exercises like breathing, five senses, in your head, diffuse yourself from your feelings and emotions. In the moment, you can enjoy the present moment. You don't have to like do anything on a paper, journaling, or particular like heavy body exercise. It's all can be done literally in your head with your fingers or a fidget toy. You don't need to have even one-on-one session with people. Like you can literally just do it by yourself in your room, in the bath, or while you're cooking. It's all can be integrated very easily and naturally in your life, which is the biggest thing why I'm like so passionate about ACT, is that a lot of CBT, DBT interventions require you to do something on a paper or something active, or take a break, take a moment, or stop your life even. With ACT, you can do it while literally cooking. It can be very naturally integrated, and it was very successful among especially single moms with kids who went to the shelters from like their after domestic abuse, because with moms they already have postpartum depression, they already have kids to take care of, they already have themselves to take care of. And ACT is wonderful because it just integrates everything natural in a real life, so moms don't have to really do anything. Moms don't have to really take time out of their busy day already to succeed in it. It's really wonderful thing. And in the group home setting, ACT can be delivered formally by a clinician, informally through daily interactions, as I mentioned, in group sessions or activities, and through staff modeling and community values. So ACT can be used by anyone as long as you understand the principles, as long as you have like trauma-informed kind of training or understanding of trauma and understanding where people come from. It can be used by anyone. It's a beautiful thing that you don't have to ever worry really about. So easily integrated no matter what the setting is. Person can be in a group setting, person can be in a shelter, in a group home, anywhere. And that's kind of the beauty of it. Yeah, our wonderful group, the certificate group, is fully online. So again, it's can be easily integrated in your live setting. You can watch the videos or enjoy the live sessions in our coursework. And it's also very flexible. So as I also teach, so I know it is very flexible. We instructors are also very flexible. So potential career opportunities that might be available upon completing this program is it's pretty endless, to be honest. It's as good as what can what you make out of it. The most common ones is, of course, working in the group homes as a support worker. So when you go into the group homes, you can work night shifts, day shifts, morning shifts. You can work at the group homes like I did with kids and youth who have behavioral problems or like previous drug and alcohol problems, kids who have developmental delays. You can also work at the residential facilities for elderly people. You can work at the safe substance use facilities. You can work as a support kind of worker, almost like an assistant to a clinician, an assistant to a social worker. You can also, there are so many options that you can actually do. You can be even like a life coach. You can be a supporter for families in transitioning. Like for example, a kid is transitioning from a group home to a family setting. You would be the one also helping kind of this kid and supporting through it. You can also be working in schools. There's a lot of private schools or Montessori schools are very popular right now, where you as a support worker for mental health can work with kids who are on a spectrum, who have FASD or behavioral problems, and support them in school settings. Can you work full-time while doing this program? Yes, you can, because it's very flexible. So there is a synchronous and asynchronous groups when you do the coursework. So if you are synchronous, you just watch the live sessions when they come out in the day when they come out, because there are sessions every single day. So you just watch video at the end of the day or at night or in the morning, depending what your job is. And yeah, and all the work there is a timeline, of course, for all your assignments. There is a timeline for everything. As long as you go to get everything done within the timeline, you're good to go. And again, if something happens, because life is life, and we understand you can get sick, you can have a family emergency, you can always contact the faculty support, and they can work on kind of adjusting what can be done to make sure you are accommodated, because again, life is life. Very often people get hired where they get their practicum done as well. So there is this benefit to this program, because again, not all programs offer practicums, and practicums are very important for learning in the setting. And that's, I would say, is one of the most biggest benefits, because some certifications don't provide any practicums. Thank you very much. It was very nice to present this, because I love this topic a lot. The moment I learned about ACT, I knew that's it. That's exactly what I want to do. That's exactly what I want to kind of work on. So thank you again for attending.